Good evening. My name is José Manuel Olivares. So I'm going to highlight now in a few slides how can we focus in the patient perspective to improve the outcomes of the treatment of schizophrenia. So I will focus in the effectiveness of treatments, meaning effectiveness as something that the treatment has to do for the patient to become fully functional, autonomous, and be able to have an independent living. So for assessing the effectiveness of treatments, we need to focus on efficacy, tolerability, and adherence in the first place. So if we talk about efficacy, the reality is that antipsychotics are very effective and they have a lot of efficacy. If we look at the data, we know that in first episode psychotic patients, more than 95% of them will respond appropriately to treatment. And what is very interesting is that around 70% of the improvement of treatment occurs in the first weeks. So we know that if the patient responds to treatment in the first 2 weeks, that means with a very high probability that that patient is going to respond adequately to treatment. On the other hand, if we don't see any improvement in the first 2 weeks, that means that much probably the patient is not going to respond in any part of the treatment. So the implication for this is that after a few weeks, no more maybe than 2 weeks, if we look at the efficacy of the treatment, we can make assumptions about if we need to switch the treatment or we need to stay on that specific drug. And the same occurs with side effects. Very soon, when we start the treatment with an antipsychotic drug in a patient, we see that some side effects may arise. Certainly, sedation may arise very soon, weight gain in the first weeks, EPS in the first weeks also, or cardiovascular problems that, for example, you can assess by the ECG looking at the QTc prolongation. But even the long-term side effects can be predicted very soon. So if you have a patient that starts quickly with EPS, much probably this patient may have problems in the future, such as tardive dyskinesia. Or if you have very high levels of prolactin when you start an antipsychotic treatment, much probably this patient is going to have problems in the future, such as gynecomastia or amenorrhea, or even osteoporosis in the long term. And the third thing, after looking at the efficacy and the tolerability of the antipsychotics in the first weeks of treatment, the thing is that after the patient is okay with treatment, we need him or her to be on treatment for a long time. And that has to do with adherence to treatment. And we know that this is very important because patients who are not adherent to medication will have a lot of problems. They won't have symptom control. They will have a lot of relapses and rehospitalizations. They will have functional disabilities. They will have loss of autonomy. They will not be able to be educated. They won't have a job. There will be homelessness, many of them. They will get out of the care of the health care system. Or finally, many of them will commit suicide. On the other hand, patients who are adherent to medication will get much better symptom control. They will increase their quality of life. And at the end, they will fulfill the main goal of the treatment in schizophrenia. That is that the person is able to have a work, to live in the community, to have a life like the rest of people in the world. So if I had to summarize what is the objective of treatment and what is the effectiveness that treatments have to have, we will focus that first, we need that the treatment, the drug, has efficacy. So there is a treatment response that we have seen that is very quick. Secondly, it has to be very well tolerated. The patient has to be comfortable and happy with the treatment. And then the patient has to take this treatment for a long time. So doing that with the patient with a good retention on treatment, they will be able to not have affective symptoms or negative symptoms or minimize them at least. They will improve their cognitive functioning or at least that cognition will not get worse with every relapse. And also we are going to avoid relapses and rehospitalization that are very hard experiences for the patient. And taking all this together, then the patient will be able to improve their personal and social functioning. That is the main goal of treatment, and that is what the effectiveness of treatments is about. Thank you.